watching coverage of the 7th Annual World Healthcare Congress in Washington, D.C. I'm Mabel Zhang. Coming up, Allison London Brown with some surprises in their latest survey. I want to ask you about the wellness topic. It seems to be heating up. How do you think this should fit into the entire discussion about healthcare reform?
Sure. Healthcare reform is of great interest to us, and it's a great time to be part of this industry. Healthcare reform really is looking at the individual's choices as well as what's going on in medical affairs, in the insurance industry, in medical devices, so it's a broad topic. But the great thing for Healthways is really the idea around prevention and wellness and how we're really looking at individual accountability. So for the first time, I feel that there really is this idea that we are looking not only at what's going on with doctors and with hospitals, but also how the individual themselves are taking care of themselves. And it's really about, again, accountability. How do we prevent the chronic diseases and the costs that we each incur as we get older? And we've entered into a 25-year partnership with Gallup, and really for the first time are able to measure a new topic of well-being, a little different than wellness because it's much more holistic. We're looking at the physical, the emotional, the social aspects of individuals, and looking at their overall life evaluation, how they perceive their lives. And this is a very interesting topic and has great interest even in healthcare reform.
When you talk about personal accountability, so are we putting this more on the shoulders of the individual then? Are we involving other aspects of the healthcare delivery system in that process?
It is. It is completely a well-rounded well-being where the individual may spend the majority of their life in a community and only go out probably 30 miles of a radius from their home. Okay. So we're talking about their social aspects. Who are their friends and family? How do they interact with the healthcare system? Who is their physician? How is the physician interacting with them and helping them to be accountable to not only care for themselves when they have a disease, but preventing that up front. And interestingly, in the latest bill, there was language around physicians assessing their patients with a well-being assessment. So it very much fits into this conversation.
So Healthways and Gallup has partnered together to come up with some concrete data.
That's correct.
About the state of wellness in the United States.
Correct.
Anything you could share with us on that front?
Sure. So we just released our city rankings, and Boulder, Colorado was the #1 rank. And for many, many factors, their overall life evaluation was high, but also their healthy behavior. So this is things like, are you exercising? Are you eating healthy? Do you have access to healthcare providers? And things that we don't really think about in terms of our overall physical health, but are you stressed most of the day? Are you angry? And do you feel that you have the opportunity to do what you love to do every single day? And all of that factors into those things.
So for the obvious points of being geographically very favorable.
Yes.
In terms of a healthy lifestyle.
Sure.
And also the offerings in the city of Boulder that support a healthier lifestyle?
That's correct. So the infrastructure itself, whether it be walking trails or the employers that are in the community that support those types of activities. Again, well-being is, yes, it's an individual accountability, but it encompasses their community, their employers, the government. It is a wide-ranging topic.
And who ranked poorest on this list? Can you share that with us?
Well, the poorest was in West Virginia, and unfortunately, this was the second year in a row where we had West Virginia in terms of state ranking. And it's interesting, I think there was just a big article about West Virginia and what they're trying to do to change things there. The other thing that we found was that some of the highest ranks were those states that were close to water.
Oh, that's very interesting.
Interesting correlation.
Were they able to also answer why that was?
We're digging into that now, so trying to really understand what's driving the connection between being close to the water. I think maybe it's just sunnier there, maybe, I don't know. So being close to the water and having opportunities to get out and enjoy nature. more. So
very good. All right, Allison London Brown, thank you so much for your time.
Thank you.